Well, good evening, ladies and gentlemen. My name is Lizette Coley, and as Executive Director of Parapsychology Foundation, and on behalf of our Board of Trustees and our President, Mrs. Eileen Coley, I welcome you all here this evening. Dr. Madelaine Lawrence, our speaker tonight, is a nurse with an avid interest in clinical research. She received a bachelor's degree from St. Louis University, her master's from Boston University, and her doctorate from the University of Connecticut. She has taught research to undergraduate and graduate nursing and management students. Currently, she is doing freelance consulting and college teaching, conducting her own research as well as writing another book. Her research in the area of near-death experiences has received considerable attention from the media, including an episode on the television show Turning Point with Diane Sawyer and an article in Cosmopolitan magazine. Her book, In a World of Their Own, Experiencing Unconsciousness, is both in hardcover, we can't see it now, but it's also available in softcover. And in fact, we have flyers here tonight for you all that the publisher is extending a 20% discount for you all this evening. And we also have 3 copies available at a cost of $15. So the flyers are here tonight. The book has received a 5-star review by a member of the Nursing Honor Society, as well as an excellent write-up by Dr. Stanley Krippner of the Saybrook Institute. We were very pleased to have her participate in Parapsychology Foundation's 1993 International Conference entitled Parapsychology and Thanatology. And may I note that that book is also available for sale here at the Foundation this evening. It gives me great pleasure to introduce to you Madelaine Lawrence, who will this evening be speaking about the principal message from her current book, A Description of Paranormal Experiences Triggered by Medical Conditions. Dr. Lawrence.
Well, thank you very much, Lizette, and it's my pleasure to be here tonight to speak with you. I'm a very informal speaker, usually much to the chagrin of the camera people. So if you have questions or comments or paranoid outbursts, feel free anytime. What I'm going to do tonight is kind of give you a very simple overview of some of the medical conditions that we know about, and then the paranormal experiences that are often kind of are triggered by, or the medical conditions that then trigger these conditions. Also, I'm going to talk about some of the research that's been done or has been started in these areas, and as I go along, as opposed to waiting until the end. I promise I won't get into a lot of methodological kinds of issues, so you don't start glazing over. But if you have some questions, I'll be happy to answer whatever I can. I think it's a whole new area. It's not a totally new area. Some people have done some research historically on medical situations and connected them to their paranormal experiences. But there's so much more that needs to be done, that could be done, and that's really what I'm trying to talk about and describe also in the book. You should all have this handout, and this is just kind of an overview of some of the topics. The first one I want to talk about is severe pain, and we'll talk about the near-death experiences because that's obviously the most common one. But patients who are in some kind of medical crisis that have severe pain often have out-of-body experiences. This is not something that's commonly described. Oftentimes, the severe pain happens in cardiac situations. People who have cardiac arrest due to a myocardial infarction might have such severe pain that, in fact, they'll have an out-of-body experience. The other area that is very common are people are women in labor and delivery, where they're experiencing pain so severe that, in fact, they're now having an out-of-body experience. We also see this with burn patients. that when they have dressing changes, this often, even though they're medicated, it can induce a lot of pain. There were actually some people who were trying to induce out-of-body experiences to prevent this severe pain. What happens, one of the reasons I got interested in this was that the patients don't know what to make of these experiences. One of the women that I interviewed who was having a baby, and she the labor was very, very difficult. So it wasn't progressing normally, and they weren't sure exactly what was happening with her. So the doctor didn't want to give her any medications, and her sense was that she was having pain so bad she wanted to die. I mean, it was extremely severe pain. And then all of a sudden, she was out of her body in the corner of the room, looking down and watching her doctors. Now, the thing that was interesting about this was the doctor called in a consulting doctor, and she had never seen this consulting doctor before, didn't even know his name. So I asked her to describe the two physicians. So she described her doctor, and then she described this consulting doctor. And the consulting doctor was taller and kind of balding on the top of his head, which was really kind of interesting considering her perspective, and that he was also thinner. So I asked one of the doctors who knew both these, and I checked the doctor from her medical record, who was the consulting doctor, and I asked an obstetrician who knew both of them. And in fact, this woman's description of these two doctors was accurate. And so that was kind of interesting from a research point of view. But what was interesting for me from the patient's point of view is that she wouldn't tell anybody that she had had this experience. She told her husband, and 20 years later, she told me that this had happened to her. And so there were only two people in her entire life that she was willing at all to share this experience with her. And one of the reasons that she said she was reluctant to talk about it was because she was afraid people would think she was going crazy. And that was her reaction to her experience, that she didn't know that, in fact, this might be happening. And that she was afraid if she told her doctor that this had happened, that he would, in fact, think that she was crazy and something detrimental might happen to her. I would say by far the majority of the patients that I interviewed who were in the hospital and had a paranormal experience because of their medical condition were concerned about that same issue, that they were afraid that they would be labeled as mentally ill if they talked about it. And however, it's not an experience that goes away. In this woman's case, she wanted somebody to talk to her about it. She wanted to know what it meant, what was really happening to her. And to this day, even now, she's still, she'll talk to me about it. And the only reason she came and talked to me about it because she was in a group like this and came up to me after the talk, and then explained what had happened to her. So it was that was one interesting experience. Now, obstetrical experiences are very common, but they're not talked about. They're talked about less than even some of the other kinds of experience. The other very common experience that happens are the near-death experiences. And these experiences are triggered by cardiac arrest, feelings of unconsciousness, respiratory distress, and also shock. They also happen in obstetrics. It's probably one of those, it's another area, again, where there's not any discussion about it, that women all the time, or very frequently, although we don't know the exact incidents, have these near-death experiences in labor and delivery. But they're not described in the literature. I've not seen any articles about it. Obstetrics is supposed to be this happy place where nothing ever goes wrong. But in fact, there are times when things do go wrong, and there are times when women have near-death and out-of-body experiences. They have nobody to talk to about them except strange researchers who want to know what it is that happens to them. I do have a video of a person who had a near-death experience when she was having a baby. Can we see that video now? This is from a taped local television show.
7 years ago, while you were delivering your second of 4 children.
My mother had died 11 days prior to this, and I was...
So your mother had just died?
My mother died of cancer, yes. And I was 3 weeks late in the delivery, and during the delivery, they gave me pain medication, which had dropped my blood pressure, and then they started noticing that the baby was having difficulty, her heart rate was dropping. And her heart rate actually picked up a little bit, but I focused on another number, which made me think that it was dropping even lower. My blood pressure continued to drop, and we started doing things, giving me fluid and trying to make my blood pressure go up. I started having difficulty breathing, and they called the anesthesiologist to do a stat C-section because they were worried about the baby, and then I was having more difficulty breathing, so they felt the need to put a breathing tube down me. I remember them turning me over onto my right side, and then I was looking at the monitor that was monitoring the baby, and I said, oh, the baby must have died. And then I remember thinking, I'm going to die too. I started having a lot of difficulty breathing, and that was the last thing I remember until next I was in the room looking down on my body, but I just felt it was, my body. And
so you were up above somehow, somewhere.
Yes, it was above my body.
You were looking down on the whole procedure that was taking place?
And I saw the nurses and doctors preparing sterile drapes and getting ready to do a C-section. And I never really looked at my face, but I just saw my body. And I knew my husband was by my side. And when I looked forward, I saw the room, but past the room was gray. And it was a really warm gray, a really comfortable feeling. And I was really curious as to what was going on. And I heard voices in the background, in the foreground. And at first I was a little frightened, and then I recognized the voices and felt very comfortable with it. And I went, this must be my relatives. They all knew me, and they're all looking like, oh, she's here, and they were all happy. And I remember feeling just so comfortable, like I had finished whatever I had to do, and there was no pressure on me. It was just all kinds of relief. And the next thing is this mask started coming toward me, this gray matter. And it wasn't a body or a figure or anything, but I instantly knew it was my mother who had just died. And I was so happy to see her and to feel, like she was still there, and she was okay. And I didn't talk to you. We didn't talk, but we communicated. And we had a really long discussion. Told each other how much we miss each other, and real personal conversation. And she wanted me to go with her. She was leading me towards the people that were in the gray matter, and I started to go, and I looked back at my husband, who was on the left side, and I looked down at him, and I remember seeing him leaning over me, and he was crying, and I said, he's going to miss me, but it won't be as long as he really thinks it will be until he sees me again. So I started going with my mother, and all of a sudden I panicked, and I said, oh my gosh, I said, I almost went, I forgot about my son, who was 2 years old at the time. And I said to my mother, I can't go with Mom. I'll come back, but I have to go back and take care of him. He needs a mother growing up. So we said our goodbyes, and she went. And the next thing I remember was I was back in the bed with a nurse calling my name, and I woke up. And the baby had been delivered.
Now, you're approaching the subject of near-death experiences more.
Okay. Any questions or comments about that experience? One of the, I've interviewed 2 other women who had similar experience in labor and delivery. One was from, she was losing a lot of blood, and another was, again, another medication that made her blood pressure decrease. It's a hunch, but it would be something I think worth pursuing. It seems like a near-death experience can be triggered by a physiologically compromised situation that's combined with a high emotionally charged situation like this one here, where women who are having a baby obviously are emotionally very charged by what's happening to them, but also physiologically things can change, and you see this kind of near-death experience that happens. Most people will equate a near-death experience with somebody who has a cardiac arrest, where they're kind of flatlined and they're not breathing or their heart's not working. But in fact, this kind of experience, and to have a near-death with this kind of experience, is not at all unusual. I did try to talk to some of the doctors in obstetrics to try to do some research in that area, and I couldn't find anybody that was willing to do it. So the only people I've been able to find are women who really are out in the community, who I'll tell somebody that I'm interested in talking to these women, and they, somebody says, oh, I know somebody that happened to, and then they'll so it's more word of mouth. But to this date, I don't know any systematic study of people who have looked at obstetrical near-death experiences. So we have no idea of what the incidence is. I do know one woman who, just when these near-death experiences were just starting to become popular, where people were talking about them, this was even before people were writing books about them, and she had a near-death experience, and as a consequence of it, became very psychic. So she would then have out-of-body experiences, and was also receiving telepathic communication. And she really thought she was losing her mind. I mean, she really thought something terrible had happened to her. She did go see her doctor, who put her on Librium and told her, just wait, it'll go away. But it didn't go away. I mean, she didn't know how to process it. She didn't know how to normalize it. She didn't know what to do with this. Now, fortunately, she got connected with the International Association of Near-Death Studies, and they explained that was, one of the side effects. But it was a horrendous experience for her, and a very scary one in that particular case. The other situation that you see near-death experiences occur are just shock. Somebody who bleeds, whose blood pressure changes, they do have near-death experiences also. So you don't have to be flatlined. You don't have to have stop breathing. You can have some just compromised situations. One of the interesting areas of research that I've tried to pursue are patients who have had near-death experiences and who are now dying, and who had had the near-death experience in the past. That one of the side effects of the near-death experience is people say that they lose their fear of death. Well, it's easy to say you're not afraid to die when you've just been resuscitated, when you're now back with the living. So there is no, you can say that. So what I was interested in is, okay, if somebody's had a near-death experience, but now they are faced with dying, how do they feel about dying? What happens? So I've been looking for and interviewing hospice patients who now who have had previous near-death experiences and who are now dying, and trying to see what it is that those experiences are like. Now, let me see, that tape may be out of order. The only thing, let's see, it's the next, not this one, the next one. That one, okay. Now, the only thing about this tape is the sound is not very good. This man died 3 months after I did this interview. And so his voice doesn't project very well, plus it was a home recorder. But he is again, I have 3 subjects that I have so far, and he's one of, they're pretty much the same stories, although he's probably the most adamant about how he feels. I've asked a lot of different hospice groups if they can find these patients for me, and so far I haven't found too many. Now it gets louder in a little bit. You got to turn it all the way up.
Before you get into the hospital, I'm sorry, I wouldn't know the truth. And went to the doctor, and they called it sat down, and they respected. And again at the ball, and showed me out. And the inside, which one on to the continent. And we got to him, and he called me back to me and said, "You're going to get to the hospital." Someone stopped by and I could show him. My wife told me that I'm so. He told me what to tell me to let me into it. And I didn't think I could do it. I'm young time, so there's nothing to do. And we can say, and the doctor would say, that's what I get to say. But I could lose. And and that happened was, that's why I built behind where it was acting and doing travel. And I'm trying to stop and wasn't and my time to understood a lot of things, a lot of things. And all of a sudden, this tongue came. And it's hard to describe because you don't go through it. It just can't explain it. No one can even try to relate it to something like that. And if you were to see that real light, open cloud, if you look up and look, the cotton, light, pure, listen to the sound of this tongue, and slowly roll. So pure, so pure, so nice, so much love. This is the thing that really makes this tongue was love. Not a person or anyone else, but you both love. These clouds are just rolling, slowly, slowly, down, and they're coming. It was like rose coming through you see through the clouds, the sun rays come through. But it was a pinkish, rose, purplish color you've never seen before. Just beautiful. Just beautiful. And as it comes, and as it comes, you got brilliant. It was the same color. I started to walk down this tunnel. And about 3/4 of the way down, this village appeared. And there was a new road. And the road went all the way to the cross. It was a dark purple, almost black purple road with no features in its face. And I know what you did. And he appeared out in the tunnel as I was walking down. And he held his hand up and he said, "It's okay now. You can go back. It'll be okay." I didn't want to go back. It was so nice and the fishes died. I want to go on. But he said, "No, you go back." So I kind of hesitated a little bit and he faded away. And I stood there for a little bit. And then I looked off to my right, and there was a path, a dark, black path. Like never have I ever seen black, that black. And I knew that was the path that up. And then the next thing I know, the nurse was making something. I hear a come to give you pain that was shot. And I don't have anything. The tumor was gone. But it was so nice, so soothing, that you don't want to come back. You just want to go on. When you saw me stay there, how did you begin to receive it? Because I just knew it was Jesus. I knew God had told me it was Jesus. It couldn't have been anybody else. sounds like a body or something that I just don't like me. It's like I would walk and sound like myself. Do you feel that God was a similar experience? Yeah. And I feel like it's not go through this again. Okay. Be going through the same thing again. But hopefully go on. I can't wait. Really, to go on. Okay, now you're facing and you're in the hospital. Is that still how you feel? Oh, yes. I don't want to leave my bed, but I am ready to go. And the Lord wants me. I'm ready. Because I know something that's so great, so stupid, so much more intelligent spot.
Any comments on that one?
Seems a little twisted.
Little twisted? What makes you think it was twisted? He wants to die. Yes, I mean, there was no doubt in anybody's mind. So, go ahead. Yes.
I understand from reading it somewhere that there's maybe a quarter of the near-death experiences that are horrendous rather than so beatific. And I just wondered if you, in your research, encountered people who had had such experiences and what you make of that.
Yes. There probably the estimate is about 6% of all near-death experiences are what they call negative NDEs. And I did have one patient that I interviewed who had had a hellish experience where he actually saw himself going down to hellish figures. It was all dark, and his father, who had died, was there waiting for him. And the father said to him, this is what hell is like. And the person just said you could feel agony. It wasn't so much that was his description or his reaction to it. And the father said it's not your time or it's not your place, because at which point this person was pretty particularly relieved. And then he had a positive near-death experience. He went up through the tunnel and toward the light. The thing that's interesting about negative near-death experiences, or even the positive near-death experiences, there's not a good correlation between, or any correlation between the quality of life people have and the kind of near-death experiences they've had. Bruce Grayson, who's a psychiatrist who's done a fair amount of research on this, and has published an article about negative NDEs, actually had a client or a subject who was a hitman, and he had a positive near-death experiences, and other people who live, quality lives, at least as we define them, have had these negative near-death experiences. In some cases, they're shown hell, and they're told that their job is then to tell people about that. But whatever the experience is, whether it's positive or negative, it's always transforming. It changes people's lives. For the most part, they become a lot more altruistic. They're a lot less materialistic than they had been before. Very interested in helping people. And it can cause a lot of problems within the family structure, because now this person has had this transforming event, and the other person has not. And the life they once had now is different because this one person has had this remarkable change. Now in this case, with this patient here, one of the things that was very interesting about him is he was obviously looking forward to dying. I've never seen a patient most people who are dying eventually accept the fact that this is happening to them and see it as relief, but very few people look forward to it. I mean, his bags were packed. He was ready to go. He was very anxious, and you notice how he covered himself and said, "I don't want to leave my family." And it was a little bit of a problem because the family was saying, "Hey, wait a minute, we don't want you to go. What? Don't you feel bad about leaving us?" And he did. He sincerely did. He was a wonderful human being. But this was such a beautiful experience for him. Now, the near-death experience he had was not at all related to his cancer that he ultimately died for. Anybody want to venture a guess as the time span between the near-death experience and the time of the video?
Did you say 3 months before, 3 weeks or something?
Those after
30 years.
he died.
You died 3 weeks after the video.
Right, that's what you said.
Yes. He had had the near-death experience 8 years previous to this. So 8 years later, that experience was still that intense, that it still had that kind of impact on him. So it's a remarkable experience. And you know what happens to people, obviously, in this when they're dying, and who have had that, this is a great comfort to them. I mean, he, you know, in terms of anxiety, and he was like that until the time he died. Go ahead.
Yeah. Why do all people who have come close to death, why is there only a certain percentage that have these near-death experiences?
We don't know that. We don't know why only a certain percentage. And it used to be, the estimate used to be that we thought about 30% of people that were close to death, either through cardiac arrest or respiratory distress, had near-death experiences. But now the estimate is probably 10 to 15%. That's what the latest research has shown. Now exactly why only that group has them, nobody's really sure.
Did you come across any cases, I think it was Raymond Moody's book, where he said people who tried to commit suicide and didn't die had very negative near-death experiences?
I don't know that it was Moody's book. The question was people who had tried to commit suicide. Bruce Grayson, again, the psychiatrist I referred to earlier, did a really great study on patients who had tried to commit suicide, and they were in that group. As far as I know, there were not any negative near-death experiences. But what was interesting about that piece of research was the people who tried to commit suicide and had a near-death experience had a sense of purpose after that, and were much less likely to try to commit suicide again at a later time than the ones who tried and didn't have a near-death experience. So it had a very positive impact on their lives.
I have two questions. One is, do you know if the hitman had a transformative experience?
Yes, that I do know. I was very relieved myself to hear that he, in fact, did have a transforming experience.
Became not a hitman?
He became, I don't know exactly what he did, but his life changed to helping people, that he gave up his past life from that and became some kind of, worked with people trying to help them.
And the other question is, are the out-of-body experiences related to NDEs that you've encountered, is it always above the body that the person seems to have a perspective from, or is it ever from the side or another, do they go to another room, is it always above?
The experiences I've had, the patients I've interviewed who have had near-death experiences seem to go in the corner. At least initially, they seem to go in the corner. If they're in a room, it tends to be in the corner of a room, and then they're looking down. They don't tend to go straight up. But although sometimes, obviously, they can happen outside, like if it's in an accident case. I'll tell you one really good story, which is not totally related to my topic, but it's kind of an interesting story. It's probably the best near-death experience story that we had. It's one of the things that intrigues us in terms of those of us who are doing research in this area. We had one lady who had a cardiac arrest, and during this episode, she went out of her body, and then she watched people resuscitate her, and then drifted up over the roof of the hospital. Now, why she was over the roof of the hospital, I don't know. But in the northwest corner of the roof of the hospital, she saw a red shoe. So when she came back down, she was resuscitated, and when she woke up, she told the nurse that on the northwest corner of the hospital roof is a red shoe. And the nurse told the doctor that was there, and the doctor went, "Oh yeah, right. Like what's a red shoe doing in the northwest corner of the roof?" But he got somebody from the building services to unlock the door to the roof and came down holding this red shoe. And so it's the anecdotal experiences like that intrigued us in terms of trying to do other kinds of research, that to try to demonstrate that in fact, and that's really the big problem is you had a lot of anecdotal experiences like this. Like one of my instructors walked in again on a cardiac arrest patient. She had been on vacation. She had gotten some plaid shoelaces, and she went back a couple of weeks later or a couple of days later, and talk to the patient, and the patient says, "Oh, I remember you. You're the one with the plaid shoelaces." And, or they'll say, "You're the one that had the polka dot blouse on," or "I like the pink blouse better on you than the one you have on today." Those kinds of stories. So that, while these patients are unconscious, this is when they're seeing these patients, and then they're coming back and they're telling them when they were out of their body, this is what they saw. And they say it like, it was just like we're seeing each other here. So we were trying to do some research that would kind of demonstrate that in fact we could show that in a control situation what happens. Let me just show you, and I'll show you what that research looked like. Can you? Let's see. The next tape. Oh, you got it in already? Oh, no, okay. This is probably was the first prospective study of near-death experiences, and it sounds funny just even saying that. When you think that we know, the nice thing about these experiences from a research point of view is we're getting good documentation that these incidents and these paranormal experiences happen with regular occurrence, which has not always been true, I think, and it has been a difficulty with parapsychological research. Okay, I'll let you watch Diane. So
Stars in rural Alabama stands up on the house.
I'm sorry.
Inside, and it
I'll get to that in a minute. I'll talk about near-death visions yeah.
Just out of curiosity, what are the doctors, the physicians, they believe that it's a byproduct of the ego or oxygen?
Could you just hold it just for a second? Can you just pause it for just a second? Well, actually, now this study here I did with two cardiologists. And one of the reasons they were enthusiastic about having me do this study was because patients would come back and talk about their near-death experiences, and they didn't know what to say to them, and they didn't know how to explain it either. So they really weren't sure what it was that was happening. This study here is done on patients who are having electrophysiological studies. Now, electrophysiological studies are studies that are done with patients who have cardiac arrhythmias. And that just means their heart is so irregular that if they don't do something about these heart conditions, that the patient is liable to have a sudden death and just die driving a car or walking down the street. So what the doctor does is he puts a catheter into the heart, stimulates the part of the heart until the arrhythmia happens, and then tries to control it with medications. What we know from previous research is that of all the patients that go in for these electrophysiological studies, 30% of them will become unconscious. They'll have to be defibrillated, and of that 30%, another 30% will have a near-death or an out-of-body experience. So here we have a group of patients that we can predict ahead of time will have a near-death or an out-of-body experience. So we set this research study up to kind of to try to demonstrate this. Now, this is TV, so it's all the visual stuff that you'll see. But what we did beforehand, before these patients went in for these studies, we gave them a personality test, and then we gave them a dissociative experience test. Because one of the possible explanations for near-death experiences, as well as out-of-body experiences, is that people are disassociating or have a tendency to that. So what we were trying to show is, first of all, are certain personalities more prone to having these kinds of experiences? Does dissociation, high scores on dissociation scale, predict whether people are going to have these experiences? If they have these experiences, do their personalities change afterwards? So we pre-tested. So we did a pre-test and then a post-test on some of these patients. I mean, when you think about it, it's like, you know, you're talking about near-death experiences, electrophysiological studies, pre-test and post-testing them. But it was a reasonable thing to do because we knew that a certain number of these patients were going to have these experiences. Okay. It's not working. Okay. Well, let's see. They're all kind of mixed up here. That's the one you just had. No, that's not good. No, it's that one there. No, that one right there. Yeah. Okay. I'm sorry.
In the room above my bed, looking down, not looking up.
I had the greatest vantage point.
I felt very much more free.
Just floating on air. You're kind of floating and you just kind of float and everything's peaceful and you do see other people.
Madelaine Lawrence, PhD and Director of Nursing Education. Describe a little bit more, like the form, did they have clothes, what age, sex? Did you tell anyone that?
No, I really couldn't because
Would she be the first person to prove the existence of a human soul?
it's like seeing a ghost, if you will, which everybody had kind of like veils, like Mary, if you will. I know it sounds corny, but this had like veils.
She was one of the new breed of scientifically trained near-death detectives. How are you? Good. I'm trying to find patients for my study for the elementary species. Here at Hartford Hospital, she is taking notes from nearly every patient who becomes unconscious. Okay.
I was suspended.
Okay. Did you feel like...
I got a saddle.
Oh, all right. So you felt like you were going to be moving?
Yes.
There's evidence here in the hospital's electrophysiology lab where cardiac tests are performed. Sometimes when people with diseased hearts undergo routine diagnostic testing here, their hearts stop and need to be restarted. It is here Lawrence reasons someone might have a near-death experience. Betty Carrigal, age 66, needed these diagnostic tests on her diseased heart. So a certain percentage of the patients will become unconscious. And what we're interested in is what happens to them when they're unconscious. I want you to help me, okay? Betty? Betty? She's out. She's out. 200.
Go ahead.
All right, off. Betty?
I don't know anything.
Betty?
I don't know anything about this.
Betty? It's okay, Betty. Betty? Betty's heart stopped for 23 seconds. It's okay. Keep that down. Later, Betty remembers nothing. But Lawrence's preliminary data indicate that about 23% of the patients who become unconscious do have some of those paranormal near-death experiences. Some of them will report having out-of-body experiences. Some of the patients have reported hearing when the doctors and the nurses weren't aware that they could hear. Do you think they really have out-of-body experiences? Certainly their perception is that they're out of their body. Whether in fact they are, that's one of the things that we're trying to establish. How? Well, we do have some signs in the room that are only visible to people if they in fact are out of their body, and that, in here? Yes. It's on top of this cabinet right here. Right up there. Yeah. Now you can see the way it's tilted that you can't read the message of this standing on the floor, so you have to sit up on a tail or be out of your body. No, you can't see it. And what does it say? Do you know? Yes. This one says the popsicles are in bloom. It's a nonsense message that Madelaine Lawrence changes often, hoping someone will come back and say it.
and challenge all of established science. Lawrence originally worked with America's foremost near-death research.
Because now the question everybody asked, well, did anybody see the sign? 3 people had the early starting of a near-death experience or an out-of-body experiences. They actually reported starting to move out of their body, but no one went far enough to actually see anything, into the room or beyond that. And unfortunately, because of downsizing and right-sizing and all those things that have been happening in healthcare, my position in my department were eliminated so that we weren't able to continue the research. It was an interesting project, and I just really felt bad. I tried to keep doing it, but these patients come in and out of the hospital they said I could continue the research. It's just, it was too hard to catch them because they come in and out of the hospital too fast. And but it was a really good study in the sense that we had a predictable number of patients that were going to have these experiences, and you could look at them prospectively as well as after they had these experiences to say. I think other people now have tried this. I haven't heard any results, but I don't know that they've used this particular patient group.
It seems like they brought it back too fast for me to have those results.
Yeah, you can't, we had to really separate out, what they were doing and what I was doing, because you didn't ever want anybody to think that they would, keep them under just so that they could have some of these experiences. That would not ethically would not have been a good thing. But I think there are a lot of, but like the obstetrical patients, for example, there's no doubt in my mind that none of them will have out-of-body and near-death experiences. That's another whole group, but we don't have the incidence of that. This particular group, because of other research we had done at the hospital, we knew how many, or we could pretty much estimate how many would have that and how long it would have taken us to gather some information. Okay, let me talk about a few of the other things. One of the questions was, what's the difference between a near-death experience and a near-death visit? You're probably all familiar with deathbed visions. Well, this was similar to deathbed visions, except these patients they were either post-cardiac arrest or they had been in shock and were just recovering it. And they would see people who had died, friends, relatives, in their room. Now, as opposed to the near-death experience where they went out of their body into another area, these people said that these people were right there. What they described was that these people were there to provide comfort for them, to be with them, or to take them across. I had one man who came and talked to me because I missed him when he was in the hospital, and then he came back, and he said he had a cardiac arrest, and in his room he saw his father and 2 brothers, all who had died, coming toward him and beckoning him to come with him. And he was there saying, no, he wasn't ready. And one of the reasons I call it a near-death visit is they don't go. They tell their friends or relatives that they're not ready. And sometimes some of the situations were kind of comical. We had one woman who was an older woman whose mother had died, and the daughter had been kind of the caretaker for the mother, and the woman who was in her 70s had a respiratory problem in the middle of the night, and her mother came and was there in the room and wanted her to come with her, but the daughter didn't want to go. She said, no, I don't want to go, and she still sensed her presence after that. And she said, my mother just wants me to go with her so I can take care of her, and I don't want to go yet. So we told her that it was okay. She could tell her mother that that she wasn't ready, that just to tell her mother to, stay where she was, that, she would be there in her own time, but it wasn't her time yet. But one of the other very interesting cases that we had was a man who had been brought into the hospital who had an acute myocardial infarction, acute heart attack, and he was on the stretcher, and he was being wheeled down the hall, and his best friend was there holding his hand, and he was going down the hall, and they were taking him into the emergency room and then up to the ICU, and this friend was there and was by his side, and when the man recovered, he said, that friend has been dead for 3 years. But during this period of time, because he was so acutely ill, he didn't make the connection that, in fact, this man wasn't there. But as far as he was concerned, he could see him and he could feel him just like he did when he was alive. So there were just as many people that had near-death experience, that had near-death visits, as had near-death experiences. They were just as common, so that it's not an unusual case. Now, one of the more unusual situations were the apparitions of the Grim Reaper. The first man that told me about the Grim Reaper said he woke up and there he was. He was standing at the foot of his bed. So I called Joanne. I said, Joanne, tell me about this Grim Reaper. What do you know about this Grim Reaper fellow? Because I didn't know what to tell him. I had never heard anybody tell me that they saw the Grim Reaper. And I asked the man how he felt, and he said it was very cold. And he said it was just a cold figure, and he described him as a he. And I said, well, how did you know it was a he? And he said, I don't know, I just knew. And then the man just kind of the Grim Reaper just faded away. So I didn't think too much about it until I gave a talk like this, and somebody came up to me afterwards. This was in the hospital, and one of the nurses said when she was 6 years old, she nearly died from diphtheria, and she also had seen the Grim Reaper at the foot of her bed. And she didn't even know what the Grim Reaper was, but she had just seen this figure then. And then one of my college students that I was giving a lecture to said that his friend's father had seen the Grim Reaper several times when he was in the hospital critically ill. So somehow this image comes into the hospital, and we don't know much more than that about it. And I'm waiting for Joanne to finish her research so I can add what this means and what this is. But I have no idea other than to say that in fact this was a phenomenon that does happen.
Are you talking cape and sickle?
The cape and sickle. I haven't seen anybody with the sickle. They haven't described the sickle, but they have the dark cape. And you notice on Bill's tape, the man who was the hospice patient, he described this figure with this cloak, and he said it was Jesus, but somebody may easily have said that was the Grim Reaper also because of the hood. But one person did say the skeletal face.
This is back to near-death visits. I never knew that's what it was called. My father had a stroke from cardiac catheterization, and after that he was blind. Wasn't unconscious, but he kept seeing people. As we didn't have aunts and uncles, there, he kept saying, "Who's Richie?" And it was a cousin who died years ago. After a while, the room was so crowded with dead people. He kept seeing those people, and we were astounded. I never knew that's what it was called.
I just named it that. That was something that was in because I had never heard about that before. Because these aren't dying people. They don't go on like deathbed visions where they're dying and then they pass on. These patients then recover, and they tell me
he never recovered, but he had a stroke and he died like 10 days later. But in those 10 days, he saw
these people. That's very common.
It was crowded.
Okay, now speaking of dying, because of dying patients, often they'll have deathbed visions, whereas initially people thought it was within a couple of days of when they were going to die that they would see dead friends or dead relatives. Now we've seen them in the hospice patients up to a month before they actually die, and they'll sense the presence. They'll see them, or they'll hear them. That it's very, very common. Now, I know Carlos's study where he surveyed doctors and nurses and asked them how many of their patients had deathbed visions. They estimated at that time about 10%. when I've talked to hospice nurses and done surveys with hospice nurses will estimate 50 to 75% of their patients will have deathbed visions, that they will actually see people who have died previously in their room, and they'll be talking to them. The question is, how do you distinguish that from the hallucinations that might be from the morphine or some other kind of medications? And usually with the deathbed visions, what you see is that the patient is aware of everything else, that they know who's sitting in that chair, they know where they are, they know what day it is, they know what's happening to them. So they're alert and oriented in general, and the only thing different is that they see somebody else in the room that they're talking to, and they can't understand why you can't see or hear that person either. But their orientation otherwise is the same. People who are hallucinating from morphine or some other drug usually aren't aware at all of, are confused about their surroundings in general. And that's one of the things that's easy to dismiss. It's easy to say that these things are just hallucinations, but they're very distinctive from the hallucinations that are caused by drugs.
I'm sure you've heard this, but I've talked to some doctors, and many of them seem to say that like out-of-body experiences are due to lack of oxygen or something like that in the brain.
Nobody knows why people have out-of-body experiences, and it's not known that they are oxygen deprived at that particular time.
I mean, even so, if someone actually saw a red sneaker on the roof, that really would have nothing to do with lack of oxygen, because you wouldn't go to the roof.
Well, you wouldn't think so.
I'm curious.
Yes. Go ahead.
I'm curious if when you interviewed the participants in your study, did you have access to their medical records?
Yes.
So what percentage would you say were actually clinically brain dead at the time when they had their out-of-body and near-death experience?
Well, what I'm talking about kind of is a collection of a number of studies. The first study I did, which is what the book pretty much is about, I used unconsciousness as the reference point. The near death is very vague. I mean, there's never been a really good definition about what people mean about being near death. So the distinction, the description I used was unconsciousness, that they had to have been unconscious in some episode and had to be documented in their medical record. Now, of those, a certain percentage, and I don't remember off the top of my head, had a cardiac arrest. A fair number of them actually had a cardiac arrest. But some of them had a respiratory arrest also. Some of them had insulin reactions. So there was a whole variety of them, but they all had some kind of unconscious episode.
But they weren't in a coma long enough to call somebody to do an actual brain death test.
Well, I'll tell you, I had one patient she was admitted, she was a severe asthmatic, and she was admitted to the emergency room, and she went into respiratory arrest, and then they brought her upstairs, so she had all the tubes in, and she went into what they call an EMD arrest, cardiac arrest, and what that meant was the electrical system in the heart was working, but it wasn't connecting at all to the heart muscle, so that the two were totally disconnected, and so, which meant she had no pulse and no blood pressure. So they resuscitated her, they gave her all the medications they could, and for 20 minutes they tried to revive her, and nothing happened. There was no response at all. So they quotes called the code. They said, it's over. The doctor went out and signed the death certificate, and they called the family and asked the family to come in. So one of the nurses, about 10 minutes after they called the code, went back into the room and started getting her ready for the family to see her, and she started breathing on her own. And so I used to go around the units looking for these patients. So when I came to work the next day, I had 4 messages on my desk. You got to come see this lady. And this woman was not at all brain damaged, had no, and I interviewed her, I talked to her, and she had had a near-death experience. She told me, that she had gone out of her body and what she could see. And she said, so I said, well, aren't you, what do you think about this? Here you were pronounced dead, and now you're sitting here talking to me. And she said, all I want to know is what's my purpose? Why am I here? Why was I, she wasn't too impressed with the fact that this had happened to her. So that was one case, and then there was another case that a student of mine had same thing happen to a man who would try to commit suicide, and he was pronounced at the scene by the paramedics and the coroner, and then came back. And then when he was in the hospital, the student of mine took care of him, and he had had a near-death experience and talked to her about what had happened. There's a lot of obviously unexplained situations that happen.
Does the details that emerge from the story correlate with the length of time that they were near death?
It's hard to tell the time. It's hard to tell the clinical time in terms of when this happens. Obviously, with these patients that are having electrophysiological studies, we can very clearly do that. So that was really the nice thing about this study. We really had a lot of control over the variables, and you could tell the time that they were out and, control the environment that they were in. But usually you can't. Usually you can't tell how long they're out totally and when they're having this experience. And sometimes patients have these experiences and we don't even know about it. The other man that was on the tape with the nurse that had her experience in labor and delivery, he had open heart surgery. And when I looked at his medical record, there was nothing on his medical record to indicate that he had had an arrest or anything unusual had happened to him during surgery. And yet he had he had a near-death experience. He went out of his body. He saw his mother would die. He was having this grand experience. But clinically, there was nothing that showed at all on the record that anything at all had happened to him. So we don't even have that documentation.
As a doctor, how do you tell if it's a dream, a hallucination, or if it's just like a hallucination?
Good question.
Or fact?
Good question. The patients will first of all tell you that it's very different than the dreams that they have. There's a certain clarity. But there was another state that people do describe as hallucinations, and hallucinations are usually very general and very vague. Everything is confused and very, very disorderly. Like one of the men I interviewed saw blood running down the side of the wall. Another man saw flying things in the room. Where these people will talk about what's actually happening there with a fair amount of accuracy. And that's what we're trying to figure out is how accurate they are. Okay, let me just go through the other ones. Bereavement is another clinical problem a clinical situation that also induces a fair number of paranormal experiences. People who are grieving have some clinical changes. They're not ill in the same sense, obviously, that some of the other patients that I described are, but they do have some physiological changes that happen with them. And I did have a subject, a mother, who was with her daughter who was dying, and at the time of death, she reported seeing the mist leave the body. After-death communication is probably the most common experience people have. They will report seeing people who have died, hearing them, sensing their presence, or having some kind of symbolic communication with them. It's a very, very common experience. There's a nice book by the Guggenheims called Hello from Heaven that kind of describes all those different kinds of after-death communications that people have. And one of the areas of research that we've been involved with is one of the explanations that people have for after-death communication is that people want to see these patients, want to hear them, so there's a big psychological need. So I've been trying to find hospice nurses who have had after-death communication with their patients, with the notion that they know these patients, but they don't have the same psychological need as a family member would be to see them. So I'll end on this story. This one hospice nurse that I interviewed went to see a patient, and she went, took care of the patient, changed his dressing, and the patient was an engineer, so everything was very orderly, and everything that he had everything set up, and he was the one that always did the finances, so he was a little concerned about his wife. So the nurse left the house, went home, and was about ready to go to bed, and was in bed, and this man appeared to her, and he was obviously in transition, dying, and he said to her, "I'm worried about my wife." And the nurse said, "You can go, I'll look in on her, she'll be fine, you've taken care of everything." So he said to the nurse, "I forgot to tell her about some papers. They're in the middle drawer of my bureau on page 63 in the book." Okay? So the nurse, woke up, she was kind of half asleep and thought it was just a dream. Then the phone rang, and it was the agency calling her, telling her that this patient had in fact died. So a short time later, the nurse went to visit the wife. Now in this case, the husband's bed was moved downstairs. He had a hospital bed. The nurse had never been upstairs, had never seen the bedroom, because the man had always been downstairs when she had been there. So using his description, she told the wife what had happened. Using the man's description, she went upstairs, went to the bureau, opened the drawer, and there were 2 books in the middle drawer, and on page 63 of one of the books was an insurance policy that he had forgotten to tell his wife about. Now, how you explain that, I don't know. I mean, that's obviously one of the things that we're interested in. The thing that was really good about this particular situation was, because she was a nurse, she didn't have the emotional investment to want to see her. So that there was that kind of eliminated that explanation for that. Now, what other explanation we have, I don't know. That's obviously more research to come. Okay, go ahead.
You mentioned that case of the woman who became psychic after having a near-death experience.
Yes.
Was she pregnant, or was she in labor when that happened?
Yes.
Have you found a lot of other cases, or some other cases, where they had more psychic experiences after?
I absolutely love it when people ask me questions that I have the answers to, or they're lead me into something else. Actually, I just interviewed a woman who had a near-death experience after she had her, during the time she was having her hysterectomy, and now she is a psychic. That's what she does for a living. I mean, that's how greatly it impacted her. She always had some psychic tendencies before that, but this experience now just, gave her much more energy in that direction, and now she does readings, and she helps the police find missing people. That's now her life. Yeah, I mean, it's an amazing, it's a transforming experience. Any other questions?
Have you heard of any experiences that were completely anomalous? You only heard it once, or it was just so strange and so completely unlike any of the others that you haven't been able to do much with it?
Yes. I suppose you want me to tell you.
Because they seem to be broken down into just a few groups.
Yes, there was another that's more anomalous, and this was a patient was dying, and his wife was with him, and as he was dying, he reached his hands up like this, and the wife who was in the room said she saw hands come down and reach toward him, and she didn't know what to make of that. That was scary for her. That really scared her. But that's not quite the only time people have talked about seeing hands like that. I've had maybe 2 other instances where people have described that.
Are those the hands of God?
Yes. I'm sorry. Yeah, I didn't talk about that. Right.
In mediumistic sessions, around the turn of the century, there was a lot of reports of disembodied hands. Do you think that there could be some parallel here with whatever the experiences that people were having then?
I don't have any good reasonable explanation for them. I mean, the subjects say that they were the hands of God. That's their explanation for that. That was their feeling about it. But I have no way of knowing or explaining that.
So what do you believe?
What do I believe?
Is it
Well,
true, or is it
One of the things that was very interesting for me in doing the research was, now the first study I did, I interviewed people who had been unconscious. So probably about 26-27% of them had some paranormal experiences, and the others had a variety of other kinds of experiences. But one of the other experiences people had was they couldn't hear anything or pick up any cues from the outside, but they had an inner dialogue. They could talk to themselves. And as I'm listening to those transcripts, they were talking to themselves. I'm thinking to myself, well, how do we do that? How do we really talk to ourselves? And they would say, I said this, and then their inner voice said this, and they would go back and forth. And what kind of occurred to me was it's kind of like, there's like an inner telepathy. I mean, we always think of telepathy from externally from people to people, but in fact, this ability to communicate internally. And as I listen to this, and I listen to all these people talk about their near-death experiences and out-of-body experiences, it seems plausible, but I obviously can't prove this, that there is some kind of inner system, some kind of inner energy system that does exist separate from the body, and that when people have these experiences, that's at least temporarily, who knows for how long, does exist. There's just too many of these anomalies to not have some kind of explanation. And most of the medical professionals are curious about this, but they'll try to explain it usually using the normal science as we understand it. There is no explanation for this with the normal science as we understand it. I mean, you can't explain how this woman could see this red shoe in the hospital. There is no explanation for that. But I can give you a hunch or a hypothesis, but that's, right now we still need a lot more research.
Wouldn't some parapsychologists say that the woman was in a state conducive to, say, clairvoyance or telepathy, but wasn't necessarily out of her body?
That's also possible. That's obviously a good explanation.
What have you worked a little bit with Caroline?
Yes.
Have you done anything in the UFO ET area?
No. I haven't done anything in that, and don't intend to. But I know he's been very involved in.
In any of your cases, have there been any reference to what some fellow researchers call a being of light, or entities that are clearly not any of their relatives, nobody they know, but when they get through the tunnel, there is some reception committee, and there are several books written, not any, where they are received by somebody whom they don't know, who's like should we say, like a host of some sort. Have you had anything like that?
Yes. A number of the subjects, the people who have near-death experience, if they go far enough, they'll either come to and see dead friends or dead relatives who are the greeting committee, or they'll see this light, this being of light. And oftentimes it's this bright light, but it's not hurtful. It just emulates love. That's always what they say. The message that they come back with all the time is that the two things, that the most important things on earth, are love and knowledge. And that's the message they get from these experiences. But I have had a number of subjects. The only experience I have not had somebody tell me personally, but other researchers have had subjects tell them, is the life review. I've never had anybody say my life flashed in front of me, but other researchers have had people tell them that. That doesn't seem to be as common as maybe had been initially thought about.
In an experiment we did years ago in traveling clairvoyance, we sent one person to observe a setup in another place across town, and then report back to us when he came out of it. And he reported being surrounded by a bluish-white light all the time. So I suspect that this bluish-white light is some form of energy that makes it possible to travel in this particular state. Other than ordinary ether, there is something more. There's an energy field that makes it possible. I've heard this in other cases too. The bluish-white light, when somebody appears to them, is surrounded by this aura that is bluish-white. Have you heard anything like that?
Not so much a bluish-white light. There's two things though. I always ask the subjects if they've had a near-death experience, what do they look like? And sometimes they'll say, they don't pay attention. So I say, no, listen, if this ever happens to you again, pay better attention. But a few of them had said they just felt like light. They always say that they feel like themselves, but that they were light at this point. But the other interesting thing about people who have had near-death experiences is a certain percentage of them afterwards will have lots of problems with electronic equipment, that they mess it up. If they get too close to anything, it won't work right. So something seems to happen in their electromagnetic field that has changed now. And when they go to the grocery store and they get too close to the counters, that doesn't work as well.
But even in the living mediums, the late Florence Sternfels could not keep a telephone going because she would touch it and the telephone was out of order.
Mm-hmm.
That was even when she was alive.
Yes.
That is certainly a change in the field in the aura, yeah.
Mm-hmm. Yep. Okay, any other questions? All right, thank you very much.
Hi there, my name is Lisette Coley and I serve as president of Parapsychology Foundation. I want to welcome you to the Foundation's YouTube channel. There's already a wealth of information available posted, and we have plans to continue to post our classic lectures and new materials, so you don't want to miss out. So hit that bell, please subscribe, and you'll be notified. And hope you enjoy.